Okay, I want you to imagine something for a second. You need surgery, but you have to be wide awake for it, held down on a table. And the person with the knife, they're not praised for how precise they are, but for how fast they can cut. For centuries, this wasn't some kind of nightmare, it was just reality. So today, let's dive into the incredible journey of how surgery went from a terrifying last resort to a modern miracle. Think about it. Before anesthesia, before we had any clue about germs, an operation was just a brutal race against the clock. The longer it took, the more likely the patient would die from shock, from blood loss, or just from the sheer unimaginable pain. So who was the best surgeon? The fastest one. The guy who could take off a leg in under a minute. It was less of a medical procedure and more like a horrific, desperate act.
To really appreciate just how far we've come, we have to start right here, back in an era where the people doing these operations, well, they weren't exactly the most respected figures in medicine. In fact, a lot of the time, they weren't even doctors.
I want you to meet the barber surgeon. Yeah, you heard that right. Need to shave? He's your guy. Got a bad tooth that needs pulling? Also his job. Need a limb amputated? You'd go to the very same person. These weren't academics. They were tradesmen who learned by doing, skilled with blades for both grooming and, well, for some pretty grisly medical work.
And this slide, it really lays out the class distinction here. You had your university-trained physicians who studied ancient texts, and frankly, they saw the messy, hands-on work of surgery as totally beneath them. They were the gentlemen, the doctors. But the barber surgeons, the ones actually cutting into people, they were seen as manual laborers. They were called Mister, which, by the way, is a tradition that some surgeons in Britain still hold on to today as a nod to their roots.
You know that iconic barber pole you still see everywhere? Well, it's a direct leftover from this surgical past. It's kind of wild. The red stripe, that symbolizes blood. The white, that represents the bandages they used to stop it. And the pole itself, it stands for the staff that patients would literally squeeze in agony during procedures like bloodletting. It's a piece of medical history hidden in plain sight.
All right, so for surgery to actually evolve, it had to overcome two massive hurdles. The first, and maybe the most obvious one, was the sheer unbearable agony of the procedures themselves. The operating theater was, quite literally, a place of screams.
This date. If you're gonna remember one date from this, make it this one. October 16th, 1846. On this day, inside the surgical amphitheater of Massachusetts General Hospital, everything, and I mean everything, changed. All because of one public demonstration. So, a dentist named William T.G. Morton uses sulfuric ether to put a patient to sleep for the removal of a neck tumor. And after it's done, the totally stunned surgeon, Dr. John Warren, says these famous words to the crowd of onlookers. For the very first time, a complex operation was done without a single scream. The age of agony was finally coming to an end.
And you see, anesthesia wasn't just about compassion. It completely changed the whole philosophy of surgery. With the patient peacefully asleep, that frantic race against the clock was over. Now, surgeons could be slow, they could be careful, precise. They could actually explore the body, develop new techniques, and finally begin to transform butchery into a true science.
But you know how it is. You solve one huge problem and it just reveals another, even deadlier one. Patients who were surviving the operations were still dying in huge numbers just days later from these mysterious infections. Surgeons didn't know it, but they were killing their own patients with invisible assassins.
This is gonna sound pretty gross, but it's true. The whole concept of germs was completely unknown. Surgeons would operate in their street clothes and an operating coat that was stiff with the dried blood and pus from past operations. That was seen as a sign of experience, a badge of honor. Instruments were just wiped on a dirty rag, if they were wiped at all, between patients. Over in Vienna, a Hungarian doctor named Ignaz Semmelweis noticed something absolutely terrifying. In the maternity clinic run by doctors and med students, who, by the way, came straight from the autopsy room, new mothers were dying of something called childbed fever at a shocking rate, almost 1 in 5. But in the clinic right next door, run by midwives, the rate was way lower, around 6%. What on earth was the difference?
Semmelweis figured the doctors must be carrying cadaverous particles from the morgue to their patients, so he made everyone wash their hands with a chlorine solution. The result? It was immediate and incredible. The death rate plummeted, but his colleagues, they were insulted. The idea that their own gentlemanly hands were unclean was seen as a personal attack. His brilliant idea was totally rejected, and he tragically died in disgrace, a martyr for medical progress.
Thankfully, the idea didn't die with him.
A British surgeon named Joseph Lister, inspired by Louis Pasteur's new germ theory, developed the first real system to fight infection. He used carbolic acid, which we now know as phenol, to sterilize literally everything: hands, instruments, dressings, even the air in the room. He created a protocol, a ritual of cleanliness that finally made surgery survivable.
So with both pain and infection finally getting under control, the stage was set for a totally new kind of surgeon to emerge. It wasn't just about technique anymore, it was about a whole new philosophy of care that combined scientific knowledge with meticulous, careful performance. And this new era is perfectly summed up by Dr. William Halsted at Johns Hopkins. He completely rejected the old ideal of the fast, flashy surgeon. Instead, he championed these principles, which are still the absolute bedrock of surgery today. He taught that tissue should be handled with almost reverent gentleness, and that every single drop of blood mattered. Surgery was becoming a slow, deliberate, and respectful art form.
And here's a great little story. Halsted's meticulous approach went into every detail, including his staff's well-being, which led to a pretty big innovation. His scrub nurse, Caroline Hampton, got this terrible rash from the carbolic acid. So, to protect her hands, Halsted asked the Goodyear Rubber Company to make some thin rubber gloves. It started as a practical solution for her, but it soon became the standard for sterility for everyone. And, as it turns out, he and Nurse Hampton later got married.
But you know, his greatest legacy might have been in education. He's the one who created the residency system, that rigorous hospital-based training program that takes new doctors and systematically turns them into expert surgeons over years and years. He wasn't just a great surgeon, he created a system for making generations of them.
And that brings us right up to the modern era. While those fundamental principles are still the same, the tools and techniques just keep evolving, all driven by this one simple goal: be as effective as possible while being as minimally invasive as possible.
You know, the old mantra used to be big surgeon, big incision. Today, it's the complete opposite. Instead of a huge opening, surgeons can now work through tiny, keyhole-sized incisions. And what does that mean for you? Less pain, a much faster recovery, and way smaller scars.
And the pinnacle of this whole approach is robotic surgery. Now, the robot isn't doing the surgery by itself, right? It's a tool, a super sophisticated extension of the surgeon's own hands. The surgeon sits at a console, controlling these robotic arms that can move with a precision and steadiness no human hand could ever match, all while looking at this amazing, magnified 3D view of what they're doing.
So, think about that. In just over 150 years, we've gone from bloody, frantic amputations to robot-assisted procedures through tiny little incisions. It's really one of the greatest stories of human ingenuity. And it really makes you wonder, doesn't it? With the kind of progress we've seen, what procedures that seem like science fiction today are going to be totally routine tomorrow?